I'm with Shirley Gutkowski, who is the owner of Crosslink Presentation and a coach with Career Fusion. How are you today, Shirley?
Pretty good. Hi, Mark.
Good. Good to talk to you. I have wanted to ask you about care that is provided in nursing home setting. And you had said something not too long ago about that people may not be aware of how dental hygiene can save on the care of our older patients that are in nursing homes. Can you talk about that for a minute? Let us know what your concerns are there.
I would love to. What I've found is a couple of pieces of information that kind of finally coalesced in my head. One piece of information that I came across a little while ago, I don't know, a year or so ago, maybe longer, was that an insurance company had found that having periodontal treatment in a patient with diabetes will save the insurance company over $2,000 a year per person with diabetes if they've had periodontal treatment done. So then I took that little piece of information and I thought, well, what happens in these long-term care facilities where about 30% of the residents have diabetes? And if a dental hygienist was involved in their care, how much money could be saved by having a dental hygienist on staff and treating the residents there? And what I found then is that there are 1.5 million beds occupied in long-term care facilities. And if you take that 30% of that number and multiply that by $2,000 per resident, you end up with a number that will cover the cost of having a long-term care dental hygienist on staff. That turns into billions of dollars saved. It's unbelievable. And that doesn't even include, that doesn't include the savings that you're going to find when you look at things like respiratory disease that dental hygienists have been found to curb, and the flu. Turns out that dental hygiene procedures in long-term care facilities is more effective than the influenza vaccination. So I'm telling you, we are missing a huge boat by not making this information more accessible in total to the general public.
Well, let's talk about the dental hygiene services that are provided in long-term care facilities. I know that in many cases, hygienists are providing training, in-service training to staff, and I believe that you don't feel like that's enough. Am I correct there?
Not anymore. Angie Stone and I developed a thing called Adopt a Nursing Home, where we trained dental hygienists to use proper terminology and give a better, cleaner message to the caregivers in these long-term care facilities. Because dental hygienists in most states are not allowed to practice within their scope of practice in a care facility without a dentist present, or without at least a dentist prescribing treatment. And the more I'm looking at this, and the clincher for me was observing a speech pathologist do an intake examination on a resident with dementia in a long-term care facilities. And for us to not be included in that assessment is crazy. To not be included in the care plan sessions that every resident in a care facility is required to have, they're required to go through that, and not be part of the quarterly update with all of the care providers giving input for each resident in the home, there is a long way to go. There are very few states that allow dental hygienists to practice independently. And I'm not saying this just to be independent practice. The problem comes in, like, let's use Wisconsin, for instance. A dental hygienist is able to have a medical assistance number and bill medical assistance directly. And that's great. And that sounds pretty independent, right? Until you step back a step and realize that this dental hygienist who has a medical assistance provider number can only provide care to residents who have been seen by a dentist, and the dental hygiene procedure is prescribed by a dentist. That's an expensive hurdle, a really expensive hurdle to provide any kind of care to the residents in the facility. So that's how it is in most states. The second part of that is that dental hygienists as a group seem to be more afraid of breaking the law than just about anybody else in the world, it seems. And dental hygienists will not brush the teeth of their own family member in a care facility because they're afraid of having their license revoked or having some sanctions applied. And that is another ridiculous hurdle. I would love for some hygienist to be sued by some dental association for brushing their sister's teeth in a care facility and the newspapers getting a hold of that. I just can't see it really happening or really coming to fruition. But dental hygienists are very, very nervous about that. Ridiculous. We need to all be together. That dental hygiene is not included in all of that. That whole package is wacko. It's wacko. Sorry.
Well, and I'm not. I know you're an ADHA member, and I'm not putting you on the spot as far as knowing all ADHA statistics. I'm sorry. My overall impression, though, that more hygienists are out there. Well, let me rephrase that. They do have the capability of going into long-term care facilities. Do you feel like that's the case as well, or do you feel like there's a long way to go before we can say we've turned the corner, so to speak? Well, you mentioned a colleague of yours up in Wisconsin a few minutes ago, Angela Stone, a dental hygienist as well.
Right.
Can you think of, if a hygienist is watching this video, what do you think you and Angela would recommend that a hygienist do in terms of breaking new ground here, going into the neighborhood nursing home, if you will, and trying to create a new level of care? What are the first steps?
Well, depends on how much guts you've got, I guess, when it comes right down to it. I would love for a dental hygienist, and I even talked to my husband about this the other day. I would love personally to have a fund available for supporting a dental hygienist who does do the following. Call the newspaper, brush your mother's teeth in a long-term care facility, and hope that the dentist or that somebody comes around and says, you just broke the law, we're going to sue you, or we're going to attach your license. I would like to have a fund, which I don't have, I want to be very clear, to help support that hygienist in doing that. I think we're going to make much bigger ground and much faster if we get the newspapers involved and the radio and the television stations. We need the media, the outside media. I'm not saying it's not important to have in our magazines, but it needs to be out into the real world.